name's Olivia Smith, and I'm a student physical therapist from the University of Michigan, Flint. Ideally, in this situation working with a COVID patient, I would have a gown, gloves, a mask, face shield, and goggles. But for the purposes of this video, I do not. Okay, so I'm Olivia. I'm with physical therapy. I've just come to ask you a few questions and see how you're moving.
Okay.
Does that sound okay to you?
Yeah.
Okay, can I get your name and date of birth?
Janice Ryerson, February 21st, 1954.
Okay, can I check your wristband?
Mm-hmm.
Okay, I think I'm in the right place. So do you know why you are here today?
Well, I have just having a hard time breathing. My husband and I both have COVID.
Okay. So tell me about what led up to that diagnosis of COVID.
We've been self-quarantining for like 10 days or so, and I started having a hard time breathing and went to my doctor, and they sent me right here.
Okay. So when did you go to your doctor or speak with your doctor?
Just today. He sent me today.
Okay. And prior to today, did you have any symptoms?
The fever and body aches. That I got that going on, and real tired. Always tired.
Okay.
So
the biggest reason you came in today was that shortness of
my
breath?
breathing is bad.
Okay. Do you live in a house or an apartment?
We live in a house.
Okay. Is it 1 or 2 stories?
2 stories.
Do you have a basement?
No basement.
Do you have any steps to enter the home?
Yep, there's 2 steps to enter.
Is there a handrail for those steps?
No.
Okay. What floor is your laundry located on?
That's just on the first floor.
Okay.
Main level.
Mhm. And your bedroom, what floor is that on?
That's on the 2nd floor.
Okay. How about your bathroom and shower that you use?
That's downstairs on the main floor too.
Okay. So prior to being admitted today, were you independent with all activities of daily living, like cleaning, cooking?
Oh yeah, I did all that.
You
Absolutely.
drove?
Oh yeah. Yep.
Okay. You dressed yourself and bathed,
Yep.
of course?
Everything.
Okay. Good. Do you work at all?
No, my husband and I are retired teachers.
Okay. Is there anything that you do for fun at this point?
We golf, hike. I walk regularly. I get regular exercise.
Good. I always love to hear that. Is there anything you can tell me about your past medical history?
Well, I have high blood pressure and high cholesterol, and then I have arthritis.
Where do you have arthritis at?
In my fingers.
Fingers mostly? Okay.
Yeah.
Do you smoke?
Oh, no, not anymore. I quit about 6 years ago. I had smoked for a good 40 years.
Okay. How much did you smoke a day when you were smoking for those 40 years?
Probably a pack a day.
Okay. Have you had any surgeries recently?
No surgeries. No.
What are your goals for physical therapy?
Well, I don't know if it's physical therapy, but I don't want to be on a vent.
Right.
I don't want to go on a vent. I've heard when people go on a vent, you don't come off, you die.
There are some things that I'm going to teach you today that if we abide by them, hopefully that will put us at a better opportunity to, get better, get out of the hospital rather than take that road of going down, get an event and that sort of thing.
Okay.
So we have some ways to kind of try to prevent that situation.
Okay.
So before we do anything else, I'm going to take your some baseline vitals. So I'll take your blood pressure
Okay.
and your heart rate and that sort of thing.
Okay.
Yeah, I'll take it in your right arm since you...
Oh, my right arm?
Oh, sorry, your left arm since
Okay.
you have that in your right arm.
Yep.
Are you having any pain right now?
No, I don't have pain, just the body aches.
Yeah.
Okay.
You're 100 over 60.
Okay.
I'm gonna write that down so I don't forget it. I'm gonna put this on your finger and we'll check your pulse ox.
Mhm.
Alright, I'll take that from you. Your pulse ox is 94%, and your heart rate is 100 beats per minute. So it's a little bit higher than what we would expect because you're sitting, but I know you're struggling to breathe like you have been, so that can bring it up a little bit. If you had to put a number on your pain scale of 0 to 10, could you put a number on your pain?
On my pain?
Yeah, 0 being no pain, 10 being the worst pain you've ever had.
Pain, body aches, probably a 6.
Okay. Okay, and then on a scale of 0 to 10, 0 being you're having no trouble with breathing, sitting, and 10 being you can't breathe at all, where do you think that's at?
That's up to a 7.
7 out of 10, okay.
Mhm.
Now I'm going to look at the range of motion and strength in your arms as well as your legs, okay?
Okay.
So go ahead and lift this arm right over your head.
Okay.
And then come back down to about here.
Okay.
Hold it there, don't let me push you down.
Mhm.
Now I'm going to move this a little bit for you.
Mhm.
But you'll have your arm out to the side, come all the way over your head,
Okay.
come back down to about here.
Mhm.
And push here. Okay. And then I'm going to have you bring your, like you're making a muscle, bring your wrist up to your
Mhm.
shoulder.
Okay.
Hold it there, don't let me move you.
Okay.
Good. Okay. Now being careful of this, bring that arm all the way over your head.
Okay. This one?
Yep.
Yep.
And then come back down so it's about right there. Yep. And then don't let me move you.
Mhm.
Good. Okay, now you're bringing that one out to the side.
Okay.
And then you'll come down to about 90. Yep, good.
Okay.
Don't let me push you down. Okay, then make the muscle here.
Okay.
Hold it there. Don't let me pull you.
Mhm.
This arm's a little weaker. Have you had any trouble with this arm?
My shoulder.
Your shoulder.
Yeah.
How long's that been going on for?
A year.
Okay. Okay. And then go ahead and squeeze my hands as hard as you can. Good. Good. Okay, now I'll check your legs. So I'm going to uncover you a little bit. Go ahead and bend this knee up,
Okay.
and then don't let me pull out here.
Okay.
Good.
Mhm.
And then I'm going to lift this up.
Okay.
Don't let me push this leg down.
Okay.
Good. And then if you keep that leg straight, can you raise it?
Mhm.
Can you hold it there?
Probably not.
I know it's a little bit more challenging. You can put it down. Okay, and then absolutely. Go ahead and bend that knee up.
Okay.
Hold it there. Don't let me pull.
Mhm.
Good. And then I'm going to bring you up a little bit. Hold your knee here. Don't let me push down.
Mhm.
Good. And then straighten that leg out all the way.
Mhm.
And then raise it again. I know this is that hard one. Good. Not bad. I'm going to test your feet now. Go ahead and bring your toes up towards me.
Okay.
Hold it there. Don't let me move you. Good. And same with this one.
Okay.
Okay. I'm going to write those down before I forget.
Mhm.
We're going to check out your sensation. So I'm just going to be touching different areas of your feet, and I want you to let me know if you can feel it or not, okay?
Okay.
So I'm going to have you close your eyes.
Okay. Left foot.
Okay. Which toe?
The big toe. Left side of my left foot. My right foot.
Middle or outside?
Middle. The right side of my right foot by my toe, little toe.
We're going to do the same thing with your hands now, okay? So
Okay.
you can have your hands wherever you want.
Okay.
Go ahead and close your eyes.
My left pinky. The left thumb. Right index finger. Right wrist area.
Good job. Good job. Your sensation's intact. That's a really good sign. I'm going to have you sit up on the edge of the bed for these next ones, okay?
Okay.
Okay. Good. So I'm just going to listen to your heart and lungs. And then we'll start moving.
Okay.
Okay. Every time I indicate, go ahead and take a deep breath, okay?
Okay.
I'll go right on your skin.
Mhm.
Take a deep breath. Out. In. Again. Good. Again. Again. I'm going to go up through your shirt, okay?
Okay.
Again. 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 Okay, good. You can just breathe normally for these next ones, okay?
Okay.
Going up through your shirt one more time.
Okay.
Okay. I'm gonna get your gown on you. We're just gonna be walking right over to that chair, okay?
Okay. I can put one arm in, but the other one I'll just leave off.
Are you sure?
Yep.
Gotta get this gate belt around you though.
Okay.
I know you're good with moving right now, but just in case you get too short of breath and need an extra hand, I can grab you.
Okay.
Would you feel more comfortable walking with a walker right now?
It don't matter.
Okay, we'll stand up and then see how you feel, okay?
Okay.
I can grab it. It's right near us. All right. I'm gonna bring this line to your opposite side,
Okay.
and then I'll help you stand up.
Okay.
Okay. 1, 2, 3. Good. And then we're just heading right over to
To
this
the chair. I think
Yep.
I can do it.
I'm gonna make sure that's on that side, yeah. Are you good there?
I gotta sit down.
Go ahead and take a seat. Reach for it first. Yep. Okay. I'm gonna take your vitals again. On a scale of 0 to 10, how short of breath do you feel right now?
I'm up to an 8.
Okay. And then your pain, is that holding steady at a 6?
Yeah, just the body aches.
And then this is going to be a strange question for me to ask, but on a scale of 6 to 20, 6 being like that was so easy, you could feel like you could do it again and again, and then 20 being like that was the hardest thing you've ever done.
Mhm.
How difficult do you think walking from here to there was?
Probably 14.
Okay, that's fair. lift this up. $110/54.
Mm.
So it did change a little bit.
Mm-hmm.
I'm gonna give you this. Put on your finger. And check out your heart rate and pulse ox. I'll take it from you. Pulse ox is 93. Did go down a little bit, and heart rate is 110. Okay. The next thing that we're gonna do is a test to see how your endurance is. Of course, we know it's a little bit limited, but it'll help us compare that in a couple days.
Okay.
So it's just a 5-time sit to stand test. So what you'll do is you'll be sitting, stand up, sit down. That's 1.
Mm-hmm.
You're gonna do 5 of those.
Okay.
And I'm gonna time you while you do that. Okay?
Okay.
Whenever you're ready.
All right. Go.
1, 2.
Okay. I got it.
That's
Hang on a
okay.
minute.
Take your time. It's whatever.
That was
pace
3?
Yep, that was 3. Whatever pace you're comfortable with. Okay. 21.26 seconds. Again, it just helps us give us a baseline of where your endurance was when you came in here.
Okay.
Okay. We're going to walk back to the bed, and then I'll take your vitals one more time, okay?
Okay.
I'll hold on to these.
Okay. Just go whenever.
Yep, you're good. Whenever.
All right.
Go ahead and take a seat.
Okay.
How's your shortness of breath at this point?
Probably about an 8.
Still staying steady at that 8.
Yeah.
So when you start to feel short of breath, go ahead and breathe in through your nose and then out through your mouth like you're blowing out a candle.
Okay.
It'll kind of help reduce that anxiety of not being able to catch your breath. Just focus on breathing in through your nose and then out through what we call pursed lips.
Okay.
I'm going to give you this to check your pulse ox again and your heart rate.
Mm-hmm.
I'm going to give you this. Pulse ox is 93, heart rate's 114. Not too bad. $110/60.
Okay.
So your blood pressure has gone up since you've been up, sitting up,
Uh-huh.
which is good.
Okay.
Okay. I'll get your gate belt off here. Get this off you.
Okay.
Have these off you. biggest complication that we're seeing with patients that have COVID
Mhm.
is that consolidation that you get in your lungs, the pneumonia, and that can lead to more challenging problems.
Mhm.
So that's why it's so important to keep moving.
Okay.
If you're laying down in bed, you're kind of letting that in kind of consolidation of the lungs, they call it, like rest in your lungs, and it could get worse. So the more you leak or move around, the more you deep breathe and that sort of thing, that prevents it from getting worse. And the more you're upright. Another complication that you can just have from laying down in bed is deep vein thrombosis, those DVTs, where you get the blood clot in your calf, and that can lead to some serious complications. So that's another reason that we need to keep moving the best that we can. So I have a few ways for you to do that. The first one, when you're eating 3 times a day, 3 meals a day, go ahead and sit up in a chair. The nurse will come, she'll help you sit in the chair, eat for your meal, and then stay in the chair for the remainder of that hour.
Okay.
So at least you're sitting in a chair for 1 hour, 3 different times a day.
Okay.
Okay? The next thing I'm going to have you do are those sit to stand. So like we did earlier when I was having you sit and then you just stood up when we did that test. You can do the same thing sitting on the side of your bed. Make sure a nurse is in here. But I want you to try 3 times a day to do 5 to 10 sit to stands. Another thing, when you are sitting in a chair, I want you to put a pillow behind your back, because it'll kind of put your spine in a position where you're not hunched over, puts your lungs in a better position to breathe.
Okay.
So you'll find that you can breathe easier that way.
Okay.
So we'll do the sitting in the chair for an hour, the sit to stands 3 times a day, and then I'm going to have you lay down. I'm going to show you a couple other things I want you to do, okay?
Okay.
So go ahead and lay right on your back.
Okay.
Oops, I'm sorry.
Lay flat on my back?
Flat on your back, yep.
Okay.
So you're going to do deep breathing.
Okay.
So you'll breathe in as deeply as you can, and then hold that breath for 3 seconds. 1, 2, 3, and then breathe out for a count of 8. So you can count in your head 1, 2, 3, 4, 5, 6, 7, 8, and you'll do that 10 times.
Okay.
Okay, so I want you to do that 3 times a day.
Okay.
There's 2 more things I want you to do, okay?
Okay.
This one, go ahead and bend this knee up,
Mhm.
and then you're going to raise this other leg to the height of this knee. Yep, and then back down. So just do 10 on each side,
Okay.
3 times a day.
Okay.
And then the very last thing is, you might have heard, but laying on your stomach helps put your lungs in a better position for COVID patients.
Yep.
So 3 times a day for at least 15 minutes. I want you to try to do that.
Okay.
So if you do kind of like all 5 of these things, it sounds like a lot, but I'm going to leave a packet here.
Okay.
And then I'll be back in the morning to kind of go over it again with you if you have any questions, that sort of thing, okay?
Okay.
Okay, so before I leave, I'm going to have you lay on your stomach.
Okay.
With a pillow under your hips. I know you're kind of tangled up here. I think if we move here, this and this.
Be under my hips.
Under your hips, yep, so you want your stomach right over that.
Okay. Okay.
And then you're try to lay flat if you can.
Oh, okay.
Okay, I know it's kind of uncomfortable,
A little.
but it will help your lungs, okay?
Okay.
I'm going to give you, so I'll have you lay here for 15 minutes, okay?
Okay.
I'm going to give you this call light.
Okay.
So I'll tell the nurse to come move you in 15 minutes or at least check on you.
Okay.
Another thing is if you can try to sleep like this.
Oh, wow.
I know a lot of times you can start out sleeping like this and then you have to move. So that's something that I'll advise you to do.
Okay.
Do you have any questions for me?
Nope.
All right. I will. I'll see you every day that you're in here. I'll talk to the doctor about getting you maybe some durable medical equipment at home if you do need progress to needing like a walker or something just to help you get along and kind of reduce your breathing. Okay.
Okay.
All right. It was a pleasure meeting you. I'll see you tomorrow.
Thank you. Bye-bye.